Patrick Hutzel from intensivcarehotline.com with another quick tip for families in intensive care. So today's tip is about brainstem injury in ICU and what should the diagnostics be if someone has a brainstem injury in ICU. So yes, the context, we are currently working with a client, and we had a family meeting with the intensive care team who was saying, that their mother, our client's mother, has brainstem injury and that she won't have any quote unquote meaningful recovery because of that. And the family had not heard or the intensive care team mentioning it after their mother being in ICU for about 2 weeks. So obviously, with me being in the meeting, I asked them whether a CT scan of the brain or an MRI scan of the brain had been done to verify the diagnosis. And they said no, a CT scan or an MRI scan of the brain had not been done to verify the diagnosis of brainstem injury. Now, interestingly enough, from my experience, I've worked in intensive care for over 20 years in 3 different countries, where I also worked as a nurse manager in intensive care for over 5 years. And I have been consulting and advocating for families in intensive care all around the world for the last 10 years as part of my intensivcarehotline.com consulting and advocacy service. I've never seen brainstem injuries not being confirmed by a CT scan of the brain or by an MRI scan of the brain. So I asked the doctor, how they diagnosed the brainstem injury, and they said, through a physical exam from the neurologist. And I find that hard to believe that, absolutely physical exam is important to check for reflexes and whatnot. However, that needs to be verified still by a CT scan of the brain or by an MRI scan of the brain in order to, make sure they diagnose our client's mother correctly. You can't just make up things based on one test, especially when it comes to brain death or a brainstem injury or damage. That is a significant diagnosis, and you can't just jump to conclusions and say, well, your mom won't have any meaningful recovery because she's got brainstem damage or brainstem injury without having the formal follow-up diagnosis. So that's why I'm saying over and over again, the biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. I've never worked in an ICU in all my time where brainstem damage has not been confirmed by a CT scan of the brain or by an MRI scan of the brain. And I will put a link below this video where this is verified with a research paper that CT scan of the brain or an MRI scan of the brain needs to be done to diagnose brainstem damage. So that is my quick tip for today. Now, if you have a loved one in intensive care and you need help, go to intensivcarehotline.com and call us on one of the numbers on the top of our website, or simply send us an email to support@intensivcarehotline.com. Now, I also offer one-on-one consulting and advocacy for families in intensive care. I talk to you on the phone. I talk to doctors and nurses on the phone. I participate in family meetings with intensive care teams so that you can make informed decisions, have peace of mind, control, power, and influence when you have a loved one in intensive care. And that's where I can help you the best. I ask all the questions that you haven't even considered asking, and you will see that the dynamics with intensive care teams change in your favor very, very quickly. Having a professional on your side, professional consultant and advocate on your side will change the dynamics in your favor so that you can make informed decisions, have peace of mind, control, power, and influence. So you can find my consulting options at our counseling section on our website, or you can just send me an email and ask for it and we'll send it to you. Now, we also have a membership for families of critically ill patients in intensive care. If you go to intensivcarehotline.com and you click on the membership link there, you can get access to our membership for families of critically ill patients in intensive care, or you can go to intensivcaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email. And we answer all questions intensive care related. We also offer medical record reviews in real time so that you can have a second opinion in real time. Again, contact us at intensivecarehotline.com if you want a medical record review and a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you are simply needing closure, or if you are suspecting medical negligence. Now, if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next or what questions and insights you have, and share the video with your friends and families. Thanks for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.